Greetings, ladies and gentlemen. This is Michael Hogue, President of the American Pharmacists Association, joining you this week for Addressing the COVID-19 Crisis, an open forum webinar series for pharmacists. We've been doing this now for 26 weeks, joining you weekly to bring you the latest information related to COVID-19 impacting your practices. So thank you for joining us for today, October 1st edition of this program. Now, I would be remiss if I didn't start our program out by wishing all of you a happy American Pharmacist Month. Today begins the start of American Pharmacist Month, and I, along with all of my colleagues at APhA, want to congratulate you for all the great work that you do day in and day out for our profession. And we want to celebrate with you all month long, so look for special things coming to you from APhA through our communications portals and our website in the coming months and weeks. Now, today's focus is going to be to discuss a Board of Pharmacy perspective on how we maintain pharmacist authorities and flexibilities during the public health emergency. I know some of you may think that this is a premature conversation, but it really isn't. Because we know that despite, we have no idea, first of all, how long the COVID crisis is going to last, how long the pandemic declaration or those emergency declaration orders are going to last. They have to be renewed every 90 days. And so we believe that it is in the best interest of the profession to begin thinking now about how we move toward making some of these things permanent. And so that's what we're going to spend our time talking about today, is how we make some of these protections and some of these authorities that we've been granted under emergency authorization to be able to move forward as a profession. We are very pleased to be joined today by Dr. Al Carter, the Executive Director of the National Association of Boards of Pharmacy. Al has a great wealth of experience in community-based pharmacy practice prior to joining NABP, and we will look forward to hearing his national perspective on those things that we might be doing now and things that are happening in the states from his vantage point. We're also being joined by Dr. John Kirtley. Dr. Kirtley is the Executive Director of the Arkansas Board of Pharmacy, and we thought that it would be great to have a state-based perspective as well, along with the national perspective. Now, I want to just pause for a moment and mention, as John is on the call today with you all, I actually am joining you by a pre-recorded message. And today's webinar is going to be hosted by some very capable folks from APhA. And the reason is because next week, the Supreme Court of the United States will hear a case, Rutledge versus PCMA, which was brought by the Attorney General of Arkansas. And at the time you all are engaged in this live webinar, I'll be actually on a press briefing with our colleagues from NCPA and the Arkansas Pharmacists Association, as well as NASPA, meeting with the media to discuss the implications nationally of this huge case before the U.S. Supreme Court. So we really appreciate John taking time today to be here with you on this program and to be able to share his insights with you. Now, we are joined today as one of your two guest moderators by Ann Burns, Vice President for Professional Affairs at APhA. And folks, I'll really tell you that Ann is the brains behind our weekly COVID-19 webinar series. She's the one that has really innovated this and kept it driving forward, and we're grateful to Ann. She is a gem, a practice guru in every sense of the word. And so you are in very good hands with Ann as one of your two moderators today. And we're also joined by Dr. Meg Frater. Now, Meg has actually been behind the scenes doing all of our polling questions every week, taking care of your questions and making sure that your needs were met as participants in our webinars each week. And Meg also has tremendous experience at APhA, having finished executive residency in association management at APhA and then having joined the staff most recently. So we're really excited to have both Ann and Meg moderating with us today. As always, we have experts from APhA staff joining us. In addition to Ann and Meg, Mitch Rothholtz, who's Chief of Governance and State Affiliates with APhA, will bring some perspectives also from his vantage point in terms of some of these permanent measures, specifically related to immunizations. You'll hear from Mitch, but other topics as well. And we're also pleased to have Karen Bolte, who's Director of Health Policy for APhA and works on our really awesome government affairs team at APhA. So you'll have the opportunity to hear from Karen as well, depending on your questions that come in throughout today's webinar. They'll be available for you as well. Now, the way this works every week is we finish up these introductions, and then we'll have interviews that will occur. Ann and Meg will facilitate those interviews today with Al and John, and we're looking forward to that. For those of you who have not used the GoToWebinar platform before, you'll notice in the GoToWebinar control panel several features that we want to point out to you. First of all, we'll take your questions live on the air today. In order to be able to do that, in the questions box, you'll need to type in the question that you would like to ask our guests today. Or any of the APhA staff for that matter, but of course we want you to be able to ask questions of our guests. So you type your questions into that chat box. When it's time in the program to be able to have your question asked, we can unmute your line and Ann or Meg will call on you to be able to ask your question. If you do not have the ability to talk, in other words, you don't have audio capabilities with your computer or your phone, that's fine. Just put no audio beside your question, and Ann or Meg will be sure that your question gets asked as time permits. By the way, if you're joining us with a landline phone or a cell phone, be sure to enter your audio PIN into your phone now. If you do that now, then at the time that you want to ask your question, the staff can simply unmute your line and you'll be live and we'll be able to hear you ask your question. So we want to give you every opportunity to be interactive. That's always the best course in these webinars, is to be interactive. We want to thank many of you who've joined us week after week. Thank you for doing that. But if you haven't and you're interested in what we've talked about for the last 26 weeks, you can go to pharmacists.com in the COVID-19 resources section, and you can actually see all of the webinars that we've conducted previously. You can listen to those. You can download the handouts. There's wonderful material. Reference material is just rich in all of these webinars. All of the links in the handouts are active links. You can click on them right in the PDF document. It'll take you right to the website where the link is located. So these are wonderful resources to you, and we would encourage you to avail yourselves of those opportunities that you have to go back and listen. So with that, we are recording today's webinar. So today's webinar will also be available for listening by others at a later time. In fact, it'll be available by tomorrow at pharmacists.com on the COVID-19 resources page. So with that, Ann, Meg, thank you so much for hosting today and helping me out. We'll give you a chance now to activate your webcams, and we'll leave it to you. Thanks, everybody. And Ann and Meg, the show is yours.
Great. Thank you, Michael. And just want to, again, echo Michael's comments in appreciation of everyone who's joined us for the webinar today. Al and John, if you can activate your cameras, we'll go ahead and start the interview portion of this webinar. And again, can't thank you enough for being on today. We know that pharmacists are very interested in all the scope of practice changes that have been happening during COVID, and you've got some really great things to share with everyone. So Al, I'm going to start with you. Obviously, we always think about pharmacist practice being regulated at the state level. And with the changes that have happened during the pandemic, how has this impacted from a global perspective how the boards of pharmacy are operating? given the fact that boards are responsible for public safety, public health?
Sure. And thanks, Dan. And first, congratulations to everyone and a warm welcome and a happy American Pharmacists Month to all of you. Thank you for everything that you're doing. In regards to your question, Ann, I think what we're seeing, at least from across all states, is that what the federal government and these federal agencies are doing is showing the worth and true value of pharmacists. Pharmacists have always been vocal, have always been active as far as trying to push forward some of our initiatives, the capabilities to do more, experts in the field, and also a very close focal point to a large majority of the population. What we're seeing is from HHS and others is how they're now starting to view pharmacists and to see the value that pharmacists bring. The challenge that we have here is the regulation piece, because even though there are certain preemptions from the PrEP Act during this emergency time, there's still challenges. I'm sure John will mention a couple to you from departments within each state that are challenging some of the opportunities that pharmacists have been given, both with COVID-19 testing, also with the capability to provide immunizations to 3 to 18-year-olds, and then also the COVID-19 vaccine. I think one of the things that the boards have been very open to and receptive of is that this is a pandemic. And so the capability to help and assist across state lines through the utilization of NABP Passport during this time has been instrumental and key to a lot of states as they deal with pharmacies having to close due to individual cases of COVID and what have you. So what you're seeing is you're seeing the flexibility, you're seeing the connectability of all the state boards of pharmacy and the capability that pharmacists have.
Great. John, do you have anything to add from the state perspective?
You know, I think, Ann, thank you, first of all, for allowing us both to be on to share some of our thoughts on this process. Yeah, I think that this pandemic specifically, and watching the federal response as well, is very unique. I think a lot of us for a long time have made preparations for natural disasters, as we've seen previously, especially with hurricanes being an adjacent state to that. And I know Al has that experience as well. But what we saw with this one was not just a nationwide, but a worldwide pandemic. That in many ways, instead of a go to help, it's become a hover in place. You know, wash your hands, wear your mask, and stay safe. It's been interesting. Al's absolutely right. You know, this is the first time the federal government has really preempted and taken a stand on this is a practice authority. So instead of it being a snail's pace, as one state at a time has statutory changes to establish whatever the baseline is for practice authority, it was done from the federal government, and that has caused a lot of people to really run to the two ends of opinions of, is this a good thing or is this a bad thing?
And that was actually something I was going to ask. Al, what's NABP's take on these broad federal authorities that are now coming down to the state boards of pharmacy?
It's a very tricky question, and it's a two-part answer. And I think, one, for these two items, this is something that many states have been fighting for. Many state pharmacy associations have been fighting for, to give pharmacists the capability to do and to recognize that capability. On the other side, though, we have to be careful and cautious of federal preemptions, because although these federal preemptions, it really provided pharmacists kind of like a silver platter to be able to do and provide care in a different way. There could be federal preemptions in the future if this was to continue, and we will continue to advocate for this, that could be negative to pharmacy. So, you know, it's kind of like a double-edged sword that we have to be very cautious of as far as how we allow federal preemptions to occur. And then states have the authority. States know best what the needs of their patients. John knows what his citizens need in Arkansas in comparison to other states. And so it sometimes can be challenging, but for what's going on right now with this pandemic and how they're seeing our value, I think it's been very beneficial. But I would say benefit with cautious. optimism,
Great.
shall I say.
John, do you agree with that?
I absolutely agree with that. Al and I have shared, the concept before that it's just like when you open up the Pharmacy Practice Act in a state, the ink pen that strikes through things you don't like can just as easily add things that you also don't like. So it is very unique that this preemption knocked down a whole lot of barriers for a whole lot of people, but at the same time, all the dominoes are strewn out across the floor, and we've got to figure out how that works. The fear is be cautious, and if everyone becomes overzealous and says we need more federal issues like this, well, they're going to get some that they absolutely don't like that will not be fixable at the state level.
Thank you. So let's move to looking at how these authorities actually translate. When HHS comes out with a new authority, what wheels go in motion? And Al, maybe you can talk a little bit about what you're seeing across the country, how states are responding to these authorities and putting them in place. And then John, we'll go to you and hear about your experience in Arkansas.
In general, most states have been receptive. There have been some states that have had, early on question because it was somewhat confusing as to the communication that HHS had, and that this notification or letter, shall we say, was preemptive of all state regulations. But what we've come to figure out and understand is that there is this sort of preemption. I think one of the other things that we're seeing in states is not dealing with the preemptions or the federal enforcement, is dealing with all the other things that are going on within their state. The challenges that they're having with resources, the challenges with everyone working remotely. How do you hold Board of Pharmacy meetings virtually? How do you continue to inspect pharmacies? That's one of the big things that we've had is many states, because of the executive orders, can't go out and inspect pharmacies. So you don't necessarily have a proper tool to regulate the practice of pharmacy that's going on in some of these states. And so that's been a very big challenge that some of the states have had to try and grapple with. And I'm sure John, being overseeing Arkansas, probably sees a lot of these things. And so I defer to him to see the true challenges that we're seeing from a state perspective.
So John, what are your challenges and what are the successes?
I think that I'll immediately start off with one of the successes. And I think one of the successes is, for a lot of boards of pharmacy, we had to figure out what would we do if 100 different scenarios happened and we couldn't work from the office. And this is a bigger scenario because not only can you work from the office or not, but it's can you get out on the road and actually do the other parts of your job, the oversight activities. So it gave us, a lot of us as boards, really the opportunity to test all the plans that we had made for years for emergency preparedness, and a lot of those have worked really well. Now, the struggles for that have been, initially in this, the phone calls were just absolutely nonstop. And what's interesting, it was pharmacists needing guidance on what they could and could not do, as well as the public actually in many instances demanding that boards of pharmacy did certain things. I'm not going to get into like the hydroxychloroquine debate, but as I'm sure Al knows as well, there were tons of calls demanding pharmacy boards do one thing or the other on making everyone in a pharmacy wear masks, making pharmacies either dispense any hydroxychloroquine or none at all, or saying that pharmacies had to close their lobbies and having to even justify in some ways politically that pharmacies are essential services that must stay open even in light of a pandemic. Probably the most difficult thing for many of us is the fact that while we had plans of what activities we were going to do for the next few weeks or even couple of months that we do at all times, we really had to shrink back in and determine what can we do without exposing ourselves or other people in a safe manner and continue to serve the new needs of the profession and the public to be sure that pharmacy services are available.
Thanks. And so some of these new authorities that pharmacists have been given through the HHS process, Al, can you talk a little bit about the ones, maybe the kind of summarize the authorities that you're seeing from HHS at what you're seeing as far as boards are implementing them. For instance, COVID testing. Pharmacists are authorized to order and provide COVID tests. Immunizations, there's the new authorities around pediatric immunizations. And then there are a number of authorities that have come down from the dispensing side, where pharmacists can provide early refills or extra quantities. How does that get administered once HHS comes out with the announcement? What happens next?
Well, that's a very good question, and so there's a couple of things that occur. I mean, from our end, it's all about communication. I think we work with the state boards of pharmacy to provide them with the tools that they need, whether it's guidance, whether it's information, so that they can develop protocols or develop instructions, directions on how how pharmacists can go about being able to do some of these services. A lot of it has already happened in many instances, and so it's, the capability to do immunizations. Pharmacists, as we all know, are already trained to do immunizations down to 3 years old. So it's just having the access and capability to do it. You look at dispensing emergency refills. In many of the states, there's already language to allow for the dispensing of emergency fills. So this just continues on that trend. The challenge, and not necessarily a challenge, but opportunity, is what happens afterwards. So as John mentioned, we've been preparing for natural disasters. We've been preparing for pandemics. We've never prepared for anything like this. We've also been preparing for when it's acceptable, the moving of the practice of pharmacy, the standards of care changes, the scope of practice changes. The opportunity that pharmacy has, working with the pharmacy associations, working with our pharmacy state boards of pharmacy, is after this pandemic subsides and we have treatments and we have herd immunity and we have, vaccines, is taking what we've learned from this emergency order and having pharmacists continue to provide those services. Because now we've proven that we can do it. They know, federal government knows that we can do it. The states know that we can do it. It's now making sure that these laws are permanent to allow for our pharmacists to continue to provide this and continue to have, provide that quality care to the public, but also, protect public health. And I think we at the forefront have the capability to do it. We're now given that opportunity to do it in this emergency period. How do we make it permanent? And so I think that's what we look at here is how do we make these changes, therapeutic interchanges, other opportunities that we have here, how do we make those permanent through regulatory changes, through statutory changes, without as much opposition, since we're doing it now currently.
Great, thank you. John, at the state level, what do you see when something like this happens?
Well, the most interesting thing probably for us, and Al is right on, communication has been an absolute key for all of us throughout this. When you have a federal authority that has a very limited scope that it just opened wide open, the biggest communication issues that we've had are probably trying to explain the difference of, well, in Arkansas, 7 and up is currently in the state rules. Well, if it's someone who's 3 to 6, well, you cannot use things like your statewide protocol for a billing purpose. If they're over 18, you also lost that population on APhA immunizations or administration of those different vaccines. So trying to explain what I often call the idiotic nuance of where exactly you fall in the grid at any given time is very difficult. And the thing is, we have all fought barriers. I mean, if you look back for pharmacist administration medications back to the mid-90s, most of the state rules and statutes that we have were a give and take. Pharmacy is the only profession that always asks permission before we do anything. And so when we've asked permission, it's you can do it if you have these guidelines. So just like our board had already discussed the potential to remove some of these endorsements you had to have on your license. It's an extra checkoff that you have to say, yes, I can administer medications. Yes, I can perform disease state management as part of written protocols. We had already discussed trying to get rid of those in a future legislative session. And this pandemic opened up that door. We requested those exemptions. We have them during the emergency declaration. And it's a really good test to show, look, who did this hurt? what does this paperwork chase really help, and who was actually harmed by it versus who did we help by getting rid of that barrier? One of the most interesting things I've seen through this is the fact that many of us as states require CPR with a live component, and you couldn't get a CPR course with a live component to actually work on a doll or a dummy early on, especially in COVID-19. So we have these barriers that are put up. I think that a lot of them personally have been arbitrary and have sat around for 20 years. And I think it's really helping to focus on what did we really accomplish with those barriers.
Thank you. So for both of you, how do you see the path forward working then to make some of these changes or all of these changes permanent?
John, you want to go first?
Question, right?
So the thing for me, I've been here at the Board of Pharmacy for almost 16 years, and so I've been through legislative sessions, either full sessions or budget sessions now for basically 16 years. And I think that what this has shown, and in Arkansas, we have a very active pharmacist association. The current exec is a dear friend of mine, John Benson, who I know he's on a call right now with Michael Hogue, our previous execs as well. And while we communicate a lot, a message that we try to get to people repeatedly, whether we're talking to students in the College of Pharmacy or pharmacists in practice, if you want to change your profession, you have to be involved. You can't sit by and watch people who may disagree with you share their opinions, because if you don't share your voice, it's never going to happen. I think that everybody that you're going to see on screen today have been huge advocates of grassroots movements and involvement in our profession. And a lot of times what I tell students is, if you really want to stand out in pharmacy school, you're going to have to do something that looks weird on paper. And I don't mean that it looks strange as in I wouldn't have done that. It looks strange as in, you know what, I'm glad somebody did do that. I'm glad somebody did go to the Capitol. I'm glad somebody did reach out for that leadership position or something along those lines. We have a lot of legislative battles that are to come, which is not generally the role of a Board of Pharmacy, but we are the ones that are there to protect the public and oftentimes can say this is not a risk to the public.
Yeah. Well, I can tell you today we love those messages, John. So thank you. Al, you were going to say something. Sorry.
Yeah, I think John's right on. I spent the last 2 weeks basically talking to U.S. senators and representatives about the opioid epidemic and how pharmacists have a capability to prescribe and serve a different purpose when it comes to opioid use disorders and what have you. And I won't say many, but those that are against pharmacists being able to do this are providing information that's false. They're talking about diversion, and they're talking about these other issues, that is just not true of pharmacists. So